The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. Thank you for joining us at today's webinar. Before we get started, I'll just ask for your patience. We'll wait a few more minutes, a minute or two, just to let the last tranche of people log in. We'll be back with you shortly. Good afternoon, everybody, and welcome to this webinar about the Thriving Queensland Kids Partnership. Before we begin, just a bit of housekeeping. As shown, I've just put the slide up. As shown on this slide, you should be able to see the GoToWebinar app by clicking the orange arrow button. You can open and close the app to either get it out of the way or access the features. The small white triangles on various panes or panels in this app let you collapse or reveal different controls. The audio pane lets you choose how to listen to the webinar and test audio settings. So if you have any issues with audio during the webinar, you can switch, for example, from the default computer audio to instead listen by telephone using the dial-in number PIN. The questions pane will hopefully be useful to you today. Microphones are muted, but you can ask questions at any time during today's presentation by typing them in this section of the app, and we'll get your questions during the Q&A session after the presentation, and we'll get to as many questions as we can, but we can't guarantee we'll get them all. Today's webinar is being recorded and will be available online soon. I'll now hand over to our CEO, Penny Dakin, who will introduce today's speakers.
Thank you, Paul. Welcome everybody to today's ARACY webinar. I would like to begin by acknowledging the Ngunnawal people, who are the traditional custodians of the land on which we are sitting here at ARACY and where we're hosting today's webinar. I'd like to pay my respects to Ngunnawal elders past, present and those emerging. I want to acknowledge that around the country today as we go live, many of you, all of you are actually sitting on Indigenous land. If you'd like to make a comment in your own space acknowledging the traditional owners, that would be great as well. As many of you will know, ARACY is in the process of establishing a Brain Builders Alliance. The purpose of this alliance is to bring neuroscience and other sciences to bear to help children and their families break intergenerational cycles of disadvantage. This effort is being headed by Laurie Rubenstein from our team, and Laurie's going to be speaking to you shortly. While the BBA will act as a centre for excellence, pulling together and localising best practice, the Thriving Queensland Kids Partnership, headed by Michael Hogan, our guest speaker today, is already working to operationalise existing knowledge in Queensland and is already forming strong partnerships to do so. As he builds the Thriving Queensland Kids Partnership, Michael will be continuing to work with us on Brain Builders, operationalising and adding to the knowledge base for BBA and the benefits of kids across Queensland and across Australia. Today we'll hear from Laurie Rubenstein, our Principal Advisor at ARACY and Director of Brain Builders. For more than 25 years, Laurie has worked with governments and NGOs in the United States, Australia and Singapore. During this time, she has conducted social research and evaluation in education, employment, health, housing, early intervention, juvenile justice, disabilities, and everything else. She has provided government agencies with policy and strategic advice on these key issues. Laurie rejoined our team here at ARACY as Principal Advisor back in March 2020. Our main speaker today, Michael Hogan, almost needs no introduction. Michael was appointed as Director General for the Department of Communities, Child Safety and Disability Services in April 2014. Michael has held various senior executive roles in the department and its predecessors, as well as Premier's departments in both Queensland and New South Wales. He commenced his career over 3 decades ago, working on the reform of child welfare and juvenile justice legislation in New South Wales, and has spent 10 years in the non-government sector in community and citizen advocacy capacity. Laurie and Michael are committed and connected to a great team to be leading the nation to focus to help children build their brains and to help families do better brain building. Please enjoy today's presentation and please send in your questions, which Laurie and Michael will address for about the last 20 to 15 minutes of the session today. Thank you very much.
Hi, Lori Rubenstein on now. As you could tell from that introduction, I'm not necessarily an early childhood specialist. I have dabbled in the things across a broad range. But what I'm going to talk about today for just a few minutes is the Brain Builders Alliance. And what it's really about is giving all children, no matter where they live, no matter who their parents are, a chance for a healthy life, a chance to thrive. We know that's not the case in Australia now, but we think it can be if we put our efforts together in that direction. So the Brain Builders Alliance engages national, international, place-based organizations, researchers, governments, philanthropists, a very broad cross-sector of people committed to using science, but particularly neuroscience, to improve outcomes for kids and families and to break the cycle of intergenerational disadvantage. It's a big ask. BBA brings the science, that is sort of the brain story, how brains develop, the evidence of what works, and methodologies for change together into action plans. I won't go through this list. Our partners include some absolutely fabulous organizations, Thriving Kids Queensland being at the top of the list, Parenting Research Center, Life Course Center, Center on Adolescent Health. It's a wonderful and very rich group of co-design partners. We also have international linkages with organizations using neuroscience to improve outcomes for kids in the UK, New Zealand, the US, and Canada. So we're learning a lot from our overseas colleagues about what they've been doing so that we can accelerate progress here. So what do? By leveraging knowledge, skills, and expertise of thought leaders, practitioners, individuals with experience, etc., we can close the gap between what we know and what we do. We're all fully aware that we do know a fair bit about neuroscience these days and about how important influences in the very early years of life can be, but we're still not acting on that knowledge. By promoting broad-based awareness and understanding of what children and families need to thrive, we can mobilize public will to transform our system. And we are working with campaigns like Thrive to 5 to try to accomplish that. By rapid testing of new programs and interventions with communities and collective impact initiatives, we can figure out what works, for whom, under what conditions, and that's critical stuff that we need to understand. And finally, by creating partnerships with leading national and international organizations using neuroscience, we can accelerate our progress. So, why the brain story is so powerful? Just going to sort of whip through this fairly quickly, but I think it's important. Because it helps us understand how human development happens. The environments, the relationships that support healthy growth, and those that hamper it, the risk and protective factors. Because the science can inform design, testing, iteration, and eventual scaling of innovative interventions to protect the developing brain and other biological systems. Because it provides a universal platform for building a coherent system of services and supports across all sectors. It provides that platform across education, health, juvenile justice, family support, child safety, and from prevention, early intervention, and universal to targeted and acute. And finally, because it's nonpartisan and relevant to all cultures, communities, and life stages. So the underlying principles, there are just three, and this is in line with the work of the Center on the Developing Child at Harvard that contribute to lifelong health and well-being. The first one, build strong, responsive relationships. That dyadic relationship between a baby and a parent is building strong brains. So relationships are critical. Try to reduce sources of stress in the environment. Now, there are lots of kinds of stresses, lack of housing or secure housing, lack of employment. There are all sorts of things that cause stress on families. But one of them that we sometimes don't talk about is the very way we design our systems can cause stress on the very families who need them. And finally, strengthen core life skills. This is probably one of the most exciting parts of the neuroscience, is we all need a set of executive function skills, the kind of things that allow us to solve problems, be goal-directed, be purposeful, to delay gratification if it's appropriate. So these are the key things that underlie using neuroscience to improve outcomes. So what we're going to do is we're going to develop an online brain story course for Australia that will be given certification at some point. The idea being that we'd like to really help strengthen the workforce, not just the early years workforce, but teachers and people in juvenile justice and all across the system in understanding what the neuroscience is about. We're going to do a webinar series on all aspects of brain development with a really strong focus on what works. One of the things people always ask, as soon as they're introduced to the neuroscience, they say, oh, it's fantastic, it's really interesting, but what do we do? So we're going to focus on what works. And then we're going to create a community of practice. And I think this is really important. Doing a course, going to a workshop, all of that can get you really energized, excited, and full of new ideas. But when you go back to your workplace and it's Monday morning, you've got to sort of figure out how to do it. And the community of practice that we're envisioning will be an ongoing kind of continuous learning group of people. We're going to develop tools to monitor progress, evaluate impact. That's another thing which everyone talks about, but nobody seems to have quite nailed it yet. We've talked to our international colleagues who aren't sure that they're quite capturing it either, but we're going to try to develop tools so that we can monitor progress and look at impact. A public education campaign may be in the works down the road so that we can talk about the importance of brain health across the entire lifespan. And rapid prototyping. Try, test, and learn experiments with our partners so that we can figure out what does work, with whom, under what conditions. So, Brain Builders and Thriving Kids Queensland is a really formidable partnership. It allows us to develop innovative solutions and also to test them in real life context, which is really critical. So by blending this science-based approach with user-centered design, we'll learn what works with whom, where, how, and under what conditions. Our children's health and well-being matter both now and in the future. When we support children's early development, we help build brains and bodies, helping kids be healthy and well now, and setting them up for a positive health in the future. Thanks.
Thanks, Laurie. I'll just hand over to Michael now. Just making that happen. Michael, you should have control.
There we go.
Welcome, Michael. Thank you for joining us.
Thank you very much, Paul. And can I thank Penny very much for her introduction, and can I thank Laurie for setting the scene and creating the context of the National Brain Builders Alliance and introducing you to the emerging community of practice. Can I start by acknowledging the traditional owners of the lands on which I live and work, the Turrbal people here on the north of the Brisbane River, and the Yarra people to the south of the Brisbane River, and pay my respects to elders past and present, and I acknowledge First Nations colleagues who may have joined us for this webinar today. Can I also thank Penny and Laurie and the whole ARACY team for working with me and engaging me to facilitate the Thriving Queensland Kids Partnership here. And can I also just acknowledge, and unfortunately you can't see, but I'm actually sitting in the offices of the Queensland Education Leadership Institute, have kindly given me the facility to participate in the webinar today. Over the past 4 or 5 months since I finished as the Director General, I've had many conversations that have shaped the initiative that I'm going to take you through today, and I want to acknowledge all of the contributions to those discussions and how that's come together in the background paper, which some of you may have had a chance to have a look at via the link. And can I also thank the many people who've informed my journey throughout my career, as Penny said, for quite a while, working in and out of government across a whole range of areas to do with the development of children and young people and adults. The primary purpose of today's webinar is to introduce you to the fledgling Thriving Queensland Kids Partnership Initiative and invite you to engage in helping to shape and then to deliver what we develop as a program of work for this partnership. I'm going to start just with a few slides about what we know is important. And Laurie's already given us a fantastic introduction to what we know is critical for the safe and healthy and happy development of children and adolescents. The quote that's up on the screen there is from the preamble to one of the priorities in the Advancing Queensland priorities, a great start for all our children. And it does capture a really critical statement about the intrinsic importance of children in our community. And it is a vital statement of public policy, and whatever happens up here in Queensland come the end of October, when we have an election, one would hope and anticipate that we will have a commitment in the next term of the next government, likewise to the vital importance of the health and resilience and happiness of Queensland children. So as Laurie said, we know a lot about what it takes for a good life for children. We know across the life domains, across the life course. Of course, I'm sure you are familiar with the NEST, the ARACY's wellbeing framework. And of course, we know as well from the work around Australia and internationally that we have to consider the world of the child, the world around the child, and the world at large. And that diagram there is from the very latest UNICEF Innocenti report, just released in the last week or two, about worlds of influence, what we know about what shapes the well-being of children in rich countries. Now, we also have in Queensland a really recent statement that captures what Laurie described and what the UNICEF report says about child development. In this instance, in the context of early childhood development. So our colleagues in the Department of Education and the early years team have just released Queensland's early childhood development core story. And the title of the introductory video and chapter describes it so beautifully. When every child grows well, we all do better. And there are chapters in that story, then in the public material about loving relationships, healthy environments, learning everywhere, strong connections, and supportive communities. A really strong articulation to those principles in what we know that Laurie mentioned a few moments ago. But we also know that whilst most kids do well, many do not. And we know that particularly in Queensland and Australia, we are a relatively well-off community. But as the UNICEF report indicates, Australia ranked on overall child wellbeing in the latest report 32 out of 38 of the well-off nations. And so I guess a fundamental rationale for the effort we're trying to bring through this partnership is that we think we can do better, and we think we can do more to shift the dial and disrupt the disadvantage that impacts on the lives of children. We know, of course, in recent months, and I want to acknowledge the extraordinary work that so many people have done and organisations, particularly at the front line, adapting to the circumstances of COVID and what we're hearing and seeing about the impacts on families and the impacts on children and young people from COVID. And we know that that's going to have a long tail of enduring impact. The latest National Child Health Report data from MCRI has just given us another insight into that impact and what we need to do to really focus and sustain our efforts in relation to dealing with those long-term impacts. So we also know, as Laurie flagged, a lot about the profound physical and psycho and social impacts of trauma. And I'm sure many of you are really familiar with the science and literature, and these are two just taken from a nice sort of diagrams from echo training. It does really point to the breadth of physical impacts of trauma on brains and on hormones, on cellular change, on the nervous system, the immune system, as well as then, and I'm sorry you can't read the very small print on the right-hand side diagram, but a whole host of then social and psychological impacts of trauma as well. But we also know that a lot about what we need to do about dealing with trauma, and it's fantastic that we've seen so many systems and so many organisations really step into building capability to be trauma aware and to look for ways to heal and recover and support people with experiences of adversity and trauma and precarity. I've taken this slide from the Alberta Family Wellness Initiative, and one of the jurisdictions that Laurie and I have been liaising with, because I think it's a really great way of capturing what we've known for decades, and our experience and the evidence tells us about what it takes to shift people from crisis to thriving. And there's a nice scale along the bottom, and as Ross Hummel and others with the prevention science keep telling us about what we need to do to boost the protective factors in children and families' lives and to reduce the risk factors, the adversities, to improve skills and abilities. And when we do all of that, when we deal with the foundations and the conditions of people's lives, we can actually shift the dial. We thankfully have in Queensland, I'm really conscious that we have so many great strategies and initiatives and services, lots of amazing research happening in our academies and the institutes. And I want to acknowledge they're just a really small sample of the richness of what we've got happening in Queensland. But one of the, I guess the questions that arises from that is, are we making the most of what we are able to do? And are we taking some of those innovations and initiatives and embedding them in our systems, building the capability of our systems and taking them to scale in ways that we know will make a bigger difference? So, like many others, and this has come through, I guess, for me, many years, but in particular in the last 5 or 6 months, lots of conversations with people about what will it take for us to be able to do better. And people at every level, whether Director Generals or frontline folks in whatever agency, in whatever non-government organisation, in whatever sector, pose these questions about what would it take. And I guess the logic behind this partnership initiative is that we think we can do more at a systems level. So what if we do more of what works and less of what doesn't? What if we could do more quickly and more systematically the translation of our knowledge from either evidence and experience and expertise into policy and practice, like the brain story that Laurie mentioned? What we could do, what would if we could do more of strengthening those integrating frameworks and pathways between systems and services that we know can make such a difference? We know our systems are robust, but they're complicated and they're complex, especially for people with complex needs or other barriers to access or legacies of distrust. We know our systems are complex, and we've got lots of great examples emerging, whether it's the things like Navigate Your Health or the Hope and Healing Framework or the Domestic and Family Violence High-Risk Teams, community youth responses in the Youth Justice Strategy, a host of examples dotted around the state of knitting our systems better together. So just imagine if we can take those progressively to scale. We also know a lot about what children and young people and families say they want for a good life, what their aspirations are for their kids, what works for them and what doesn't work for them. The work that the QFCC do in Queensland, engaging children and young people's voices, the Growing Up in Queensland report, is an extraordinarily rich insight into what young people say is important to them and what they want for themselves and their family and their communities and their friends. All the way through to, as I mentioned, the work that many organisations do, tapping into the lived experience and the voices of children and families. So what if we can actually take that really even more strongly into our system design and our practice development? And what if we built on ARACY's The Nest, the Great Start for All Our Children commitment, and in particular the recent refresh of the Closing the Gap National Partnership Agreement. And I would encourage any of the mainstream organisations and folks to have a really good close look at what that challenges all of us to do if we're going to realise the aspirations agreed by governments and the coalition of First Nations peak organisations, including SNAIC and Family Matters and others. And of course, then in the current context, what if we made the most of this Build Back Better moment in our recovery and the reset or the renewal from COVID, and put children, as many of the national campaigns are saying, put children first and at the core of our nation building. So another question that's been coming up a lot is what if we actually enabled all of our caregivers and educators, and indeed our justice workers, to operate as a child and adolescent development workforce? What if we all were equipped with the same or common, well-framed, well-evidenced messaging for parents about child and adolescent development? What if all of our system leaders were on the same page about the very latest from neuroscience and all of the other sciences that should inform us? What if we built a common set of knowledge and skills for the workforce, and built the platforms and tools that enabled folks to be on the same page? So because of those sorts of questions, and again, I want to acknowledge and thank Penny and her team, ARACY has started this work and working with me to facilitate this emerging, thriving Queensland Kids Partnership, with a view to harnessing those strengths and initiatives and passions and networks, the knowledge we have, into a purposeful partnership for a change in mind. And you can see in that diagram the sort of perspectives and capabilities that we're hoping we can mobilise over time to grow out this partnership. And in the next little while, we are going to start a sort of co-design process that will look to build out a 3 or 5 year program of activities that will both leverage existing initiatives. So, for example, the fabulous work that has been evolving in place-based initiatives like Logan Together, and in Every Child CQ, or in Bundaberg, or in Cairns South, as well as in identifying new opportunities and working across the agencies, the non-government sector, the universities, to bring resources and shoulders and effort together to do things that we haven't yet got happening in Queensland. It's really early, but what we've, in our discussions and after our first steering group meeting a couple of weeks ago, we've identified some early possible domains to look to build out really practical initiatives. So one of those is in relation to systems leadership at strategic and program and local levels, and I want to acknowledge the support from the Director General of the Department of Education. You know, he came back very quickly in his reply saying, you know, Connect for Children, the early years count initiatives that are giving effect to that commitment around a great start for all our children, is where he really wants us to engage with those folks across Queensland. Lots of opportunities we see in workforce capability, working with the universities, working with the professional development providers around building in the sciences, as Laurie mentioned, particularly with the brain story, but all of this child development, adult and human development sciences into our workforce capacity building. Lots of work, lots of efforts in bits and pieces around better data to enable communities to make choices about what's important and to understand where they're at compared to others and where they want to be. So one of the priorities is emerging around opportunities to do better with data at a community level and at a systems level. And of course, building out the opportunities around child and parent and carer and community engagement, whether it's a place level or service level or digital level. Amazing initiatives like the Inclusive Ed education platform that QUT have built with the Autism CRC in partnership with the Departments of Education and so on. Just fantastic examples. The Centre for the Digital Child opportunities that we can only imagine what we could do. So, as Laurie mentioned, Thriving Queensland Kids Partnership is looking to start with the foundations and the conditions. We're really pleased and keen to be an active partner and player in the National Brain Builders Alliance that Laurie gave us an insight into, for all the reasons that she mentioned, and I won't sort of go over those again. But we think that is a really strong and unifying focus. It's not the end of the story, it's the start of the journey. And we want to pick up then all the other strengths and channels and initiatives that we've got available to us already in Queensland or from elsewhere as we start to build out that program. As I mentioned, we've been looking around at other jurisdictions for inspiration and ideas about who has done things like this. And we have drawn quite a lot of inspiration from Alberta in Canada, who for 10 years have been going at this pretty hard with a really extraordinary support from the Palix Foundation, but with high-level government commitment from their ministers and their deputy ministers, all the way down to communities and schools and service providers, but with a really smart approach to how do you change at all of those levels. How do you do individual change, organisational change and systems change? And their theory of change that's represented in the diagram here, I think is one of the best I've come across. And there are others, but this is one of the best I've come about. How do you operate at each of those levels to shift systems, to shift results? And I would encourage anyone who's interested in the way they've done the brain story and all then the other stories about child development to go and have a look at that. The Palix Foundation and the AFWI website's fantastic, rich resource. And interestingly, the work they've done now has been picked up and is being applied and adapted in all sorts of contexts, not only in Canada and in the US, but in the UK. As Laurie mentioned, we started to talk to many organisations who've been on this journey as well. For example, we've had a really rich dialogue with the Canadian Centre on Substance Abuse and Addiction, who've picked this up in their work over the last couple of years, building the capacity of the drug and alcohol sector across Canada to understand the neuroscience and to enable and equip their workforces, public and community-based, to improve their engagement for people who struggle with substance use and addiction. So I'm just going to wrap up in a couple of minutes, but I do want to acknowledge who we've engaged with so far, and I want to particularly thank our startup contributors, obviously ARACY, but also Health and Wellbeing Queensland, the folks at QUT, Frank Tracy at Children's Health Queensland Hospital and Health Service. Frank has agreed to chair our steering group. Ivan Frkovic, the Queensland Mental Health Commissioner, and as I've mentioned, folks at the Department of Education. But we've also had very positive responses and indications of support from the Queensland Family and Child Commission, the Department of Health, the folks where I am at the Queensland Education Leadership Institute, the Department of Child Safety, Logan Together, Department of Aboriginal and Torres Strait Islander Partnerships, Brisbane Catholic Ed, and so many academics across the health and justice and education, creative industries, all host and justice faculties across our unis. So I really want to acknowledge all of that support that's emerged. And just to mention that we've started conversations with a lot of key folks in our peak and representative and other service organisations. We've got a lot of those discussions to go. So bear with us as we make contact and get in touch and talk through what this could do and how you might be engaged. I want to again thank ARACY and those funders because we are just about to this week start recruitment for a partnership and project officer position based up here in Queensland, employed by ARACY, that will start to build out this partnership and carry up and pick up some of those discussions. So I'm going to finish then by, I guess, a little indication about how you might be engaged, you and your organisation. If you are not already a subscriber, a member of ARACY, then I'd encourage you to join ARACY. As I flagged, we are very soon going to start a co-design process for the Thriving Queensland Kids Partnership Initiative, and we're going to invite you in soon to share ideas and innovations via the ARACY Engagement Hub. So we need to build a page and some material to support that. Really invite you and encourage you, please, to share the materials. There is the long background paper, but we'll also be putting up very soon a short summary, sort of overview of the initiative. If you would like to host briefings with your networks, please get in touch with us. And we will invite folks to progressively join this partnership, and we'd be thrilled if you would connect with us through the email address that I've mentioned that's up on the screen there, tqqp@aracy.org.au. So that's the last of the slides. We're keen now to get into some discussion about your questions or comments. We're really hoping today to have introduced this initiative to you and to encourage you to get engaged. So thank you so much for joining us, and we look forward to a dialogue now or as we move forward. Thank you very much.
Turn it over to me.
Thank you, Michael. Thanks for that excellent presentation. And we now have some questions which Laurie is going to read, and you guys can discuss.
Okay, a couple of questions have come in. Some I'll throw to you, Michael, some to Penny, and maybe to both of you. The first one is, are we using the science behind ACEs, Adverse Early Childhood Experiences? And I think you sort of touched on that, Michael. You might want to say something more.
Yeah, no, thank you very much. And I did in a very fleeting way, and in one of two of the slides referred to adversity and trauma and precarity or precariousness, but absolutely with a view to drawing down the very rich knowledge that we have about adverse child experiences. And again, in the slide that showed the scale and how do we disrupt or shift the dial on disadvantage, you know, one of those factors that we need to force down is the exposure of children and families to adversity, and that's very much at the centre of our approach to the way in which we take the partnership forward.
Thanks, Michael. Another question came in from a collective impact initiative in Queensland, wondering how they can be involved.
Excellent. So we'd love all of those initiatives to be involved, and I've known a number of them and have reached out to a few of them so far. If you haven't heard from us, then we will be in touch, but don't wait. Please contact us through the email address, as I mentioned, and we'd love to talk to you about what you're already doing, and how we might be able to add value and how you might be able to contribute to shaping what the partnership does with its program of work.
Great. Okay, someone else asked the question about how can we implement this kind of stuff with children who are in out-of-home care when they don't have stability of placement?
Yeah, really great question. And folks who work in that space know better than most the consequences of the life stories and experiences of those kids, both the adversity and the trauma, but also the extraordinary resilience and strength that so many of them demonstrate despite what they've had to deal with. And despite the fragility of their living placements. And, there's a whole raft of work I know the department and its partner organisations are continuing to do to try and improve the stability of, in fact, the alternatives for kids in out-of-home care. And I acknowledge, the work led by Peak Care, the Hope and Healing Framework, for example, an initiative to build workforce capability in that sector, drawing down a lot of this knowledge and evidence. But there's absolutely no doubt those kids deserve a lot more of what we should be able to mobilise and deliver to support them in their journeys.
Right. Okay. The next one, I'm just going to read the question because it's quite involved, but I think it's really important. What if we explored peer support programs that reduce social isolation for parents, antenatal to 2 to 3 years postpartum, with an army of volunteer parent supports, provided with initial education on building brains and working with vulnerable families, supported by professionals and ongoing professional development tailored for this unique workforce? It exists, but lives outside the dominant domains of the current service systems. Where is the consideration of this?
Do you mind if I?
Yeah, go Penny.
Yeah, is that okay, Michael?
Yep.
Great. Look, this is a question I have to say that goes straight to my heart and something I'm really passionate about, and something that ARACY is keen to explore and to be thinking about in the context of both Thriving Queensland Kids and the work that we're doing nationally, and really fits within our right at home sustained nurse home visiting model. We know that there are some really intensive support programs that actually are currently structured within the arrangements or the universal care platforms and the more intensive support platforms that sit on top of that. And I think Right at Home is a really good example, but we're starting to think about, how that fits in a continuum of care for these families that actually do all of those things that question alluded to. And we know that the power of peer-to-peer mentoring, particularly in parenting support programs, is actually a really highly effective and evidence-based response to addressing social isolation, working and helping parents form solid relationships and connection to community, and all of those things that we know are just fundamental to people doing their best possible parenting. And so, for me, a great example is where you actually, you have it's almost a pyramid of activity where you've got your fabulous universal platforms through things like maternal or child health. You have more targeted programs that actually work with families who need additional support. Then you've got a program like Right at Home, which is highly responsive and definitely tailored for, people on that next level of continuum. But as people, are supported and grow in their own capacity as parents and have their, levels of parental self-efficacy and their ability to understand the power of their parenting, and as they grow in their own confidence in that, stepping down to peer support programs is a really, really powerful way to keep people connected and almost grow what we would call a community of practice around parenting within local communities.
Gee.
Thank you, Penny. Thank you, Penny. Perhaps if I could just add a couple of comments to that, which I entirely agree with, Penny, your response. I guess the thing I'd add to that is, the answer is not just more and better systems and services. The question goes absolutely to a really critical point about the power of community, the power of peers, the power of kin, the power of neighbourhoods. And, we've spent, 20 years trying to deal with the fragility and the fragmentation of communities and families and neighbourhoods. And, one of the critiques of our systems is that we haven't paid enough attention to how vital are those community contexts and community supports and the connections and the agency of people and families and the people around families. And, but we have seen in COVID, thankfully, the power demonstrated of really good community effort as well as good care systems that engage communities. And we see in those collective impact initiatives, Logan Together and others, lots of great examples of community being mobilised, and that absolutely needs to be a core part of the way in which this proceeds. We trialled in Queensland, for example, a partnership with First 1,000 Days Australia to train and mobilise peer supporters for First Nations families, particularly young parents, in the Moreton and Townsville regions a little while ago. We've seen in COVID the mobilisation of a care army in Queensland. Well, imagine if we could actually then pivot that as we come out of COVID to a care army for kids and families. So I think that's definitely a really important space for this to encourage thinking and action.
Thanks, Michael. The questions are coming in fast and furiously, so we won't get to them all, but let's take this next one because I think it's one of the really big nuts we have yet to crack. Poverty is a major contributor to child adversity. How will this initiative tackle this structural issue? Should we be considering initiatives such as universal basic income?
Thank you. And Penny, you might want to make a couple of comments as well, because I think both you and Laurie might have flagged earlier, there's obviously a national context for this about what could and should happen, perhaps at a federal level, particularly to deal with some of the factors that give rise to poverty and exclusion and disadvantage, and the barriers to folks actually breaking those out of those sort of intergenerational cycles that we mentioned earlier. There are, of course, really important national campaigns and initiatives underway. The work by Thrive by Five that you mentioned, Laurie, around a national early years system, the work that ACOS is doing, the work that Families Australia has led for the National Coalition on Child Safety and Wellbeing, the many initiatives that actually go to trying to change the conditions that create these circumstances and experiences. And as you flagged, Laurie, these initiatives, the Brain Builders Alliance and the Thriving Kids Queensland Partnership, do connect to that national and state effort, and of course, the efforts at a local level and a state level too for, economic recovery and social recovery from COVID are another part of that.
Thanks, Michael. Penny?
Yeah, look, thank you, Michael. This is another one that I could talk about for some time. Over 1 million children in Australia. That's 1 in 5 children in Australia roughly, are living in poverty. This is not an issue that we can ignore. This is not something that, if we don't address this issue, this fundamental issue, there's a lot of stuff. I mean, we can do a lot of stuff, but this is one we do have to crack. There was a really interesting report yesterday. I don't know if you've seen it. Hopefully many of you have, from the Brotherhood of St. Lawrence, which actually really made clear what this means. And it was a report about the way single mothers had changed behaviour in light of the increase to job seeker payments. And it really, at the end of the day, boiled down to meals on the table. It meant that kids living in poverty were more likely to actually have a meal on their table because of increased income levels into households. Is universal basic income the answer to that? I don't know. I'd love to be able to hop on this webinar and say yes. I'd love to tell you that there's a robust body of evidence that says this is the thing in Australia that will actually turn the tide. We haven't done that work in Australia, and there's plenty of evidence internationally, but it's not been something we've been prepared to give a go yet in Australia. If there's anybody listening who wants to fund a piece of research to that effect, I tell you, we're your man. But I guess I have to emphasise that point, that unless we crack this nut, unless we figure out how to get these kids out of households and these families out of situations where they are genuinely living in very adverse circumstances driven by poverty, we're really not going to be as successful as we would like to be.
Thanks, Penny. And I would just say ditto to all of that. I would love to see Australia seriously consider universal basic income. It has worked beautifully elsewhere, and it would be wonderful if we could trial it in Australia. The next question, Michael, could you expand on that really interesting what if proposition that was about professionals in many sectors effectively being child development professionals, and that they would have the capacity to act in children's interests based on relevant knowledge? Do you want to say some more about that, Michael?
Yeah, thank you. Look, this is really, I think, such a significant opportunity for us. And one of my observations, and something that many people have commented on in our discussions over the last, years and months, is that often our systems and our professional and our clinicians and our frontline workers, paraprofessionals, are trained and given language and concepts and tools in isolation from each other. And so there's a challenge sometimes even getting on the same page with same understanding of the science or the knowledge, or sometimes even the words we use are understood differently from one sector or system or discipline to another. And I think it would be really powerful if all of the workforces that interact with children and adolescents and families saw themselves as part of a meta child development workforce. Interestingly, when we talk to Alberta, to the Ministry for Children's Services in Alberta, they refer to all caregivers, all healthcare workers, parents, grandparents, early childhood workers, child safety workers, family support workers. They refer to all of them as a caregiver workforce. I think it's really simple but incredibly powerful. But it's got to be more than words. It's actually got to be followed up with the knowledge, the understanding, the language, the tools, the platforms to support that joined up work and that joined up way of thinking. I think that's such a rich opportunity for us in Queensland and elsewhere to see those workforces and the justice workforce as all part of a broader child and adolescent development workforce.
Thanks for that. Again, ditto. I agree with all that. I'm going to turn it back over to Penny to say a few words.
Yeah, look, as Laurie had indicated, we are inundated with questions, Michael, and I'm so excited because I think what that means is that there's such a passion and a commitment for this work amongst a group of really powerful people in Queensland who genuinely can make a difference by joining up the work that they do through the Thriving Queensland Kids Partnership. We are delighted to be auspicing this new initiative. It's exciting, and it's a good opportunity to really make a difference on the ground. And I just want to emphasise our ongoing commitment to this work. I do want to clarify something I said earlier. I did sort of allude to saying wanted kids out of poverty, in households in poverty. What I actually meant was I want to support families who are living in poverty. I want to make sure that we have a vision for getting families out of poverty, just in case my words were not construed how I had it, or I hadn't articulated my words how I had intended, so my apologies there. It's been a delight to have you with us today, Michael, and to you too, Laurie, as we've talked about this. There are so many people who have come on the question function to indicate their willingness to be involved and to want to be a part of Thriving Queensland Kids Partnership. There are details on the slide about how you can contact us at ARACY. I want to draw your attention to our website, aracy.org.au, and the /register, where you can sign up to our weekly e-bulletins and other communications from us. The slides and links that are in today's presentation will be available through our newsletters shortly. And if you're not registered, if you go to that register page, you'll be able to sign up and get access to those things. So my last duty is again to thank Michael Hogan and Laurie Rubenstein for your contribution to this webinar today. Thank you so very much, everyone, for joining us. We look forward to having you on board for our next ARACY webinar soon.
Thanks, everybody.
So we can get a